I sort of fell into AIDS activism in the mid-90s. I was just finishing grad school and I was trying to figure out what I wanted to do when I grew up. I wanted to do work around something that was really engaging around social justice and health. Um, and then in my own community, and that's when I discovered the Massachusetts Asian AIDS Prevention Project, which is MAP. I fell into being an executive director for this organization. I thought, okay, I'll try it for a couple years. 20 years later, you know, this was my I found home in many ways. And a lot of it had to do with the relationships, but a lot of it had to do with the fierce desire to fight for what is a do right, I feel, for APIs to be seen, to be visible, to matter, not just within our communities, but to the broader API community. I mean, I think the South Asian and the Pacific Islander community really probably experienced this, of being a little bit outside of what people conceive as Asian. I think it's still a work in progress, even in 2018, around whether South Asians fit into the API rubric. And I think it depends geographically on where you are. So probably if you say API in New York, it does include South Asians. But in LA and San Francisco, I'm not so sure. I think the South Asian community is also a newer immigrant community. But I also think that there's some work within the Asian and Pacific Islander community to be done around understanding what the South Asian community is, what the needs are, what the issues are, cultural, language. There could be like an underlying racism as well there as well. When I first started working in 1995 in the API community around HIV in Boston, it was a fairly small community that had come together in response to the fact that there wasn't a lot of culturally appropriate, language appropriate HIV sort of support for people living with HIV, but also to do education. And I quickly got connected to a lot of activists from across the country through this Forum network, because I think San Francisco, LA were already sort of years ahead of sort of the East Coast. And so that really helped me to feel like I didn't have to reinvent, that there were models out there, that there were also individuals that I could call on to get advice or just camaraderie and peer support. I decided to transition in 2002 to the Asian and Pacific Islander Wellness Center in San Francisco. You know, the East Coast was a very new community trying to really figure out and step into a place of formation, whereas the West Coast, I mean, being here multi-generational, there was more power in organizing, for sure. There was almost a relief for me when I came to San Francisco and I saw, locally at least, just the number of APIs, period. The local context of advocacy and policy, that there had been more inroads, and particularly in a city like San Francisco, which is 1/3 API. Once that I understood the nuances, actually I felt like the differences were not so different. I think women, queer women, lesbians, and transgender women were all really part of the fight and the rubric around API and HIV, and there was a lot of contribution. I think women became more prominent in leadership, probably not so much on the West Coast, but on the East Coast for sure. I was one of them. Normally you would see men leading these organizations, so sort of having to face a lot of gender challenges, like it was just you weren't allowed into certain circles. But at the same time, I think in Boston, what was really amazing is that I was connected to a whole bunch of grassroots leaders that were women of color, and sort of being part of that network and circle was really a unique leadership opportunity for me. And so I think that really started to make me reflect on, like, what is it that I wanted to really do. Women living with HIV feel very invisible in the API community. Are there women living with HIV? Of course. there are. They tend to go to more women-centered services to really get their social support, their medical support, all of that. I think with more women leaders in the mid-90s, I did see some change where women were starting to come forward and say, I'm an API woman. I'm an API person and a woman, and these are the context of some of the issues that I've been dealing with. And because HIV in the API community has been really dominated by the LGBT space, it does play out, of course, differently for women who contracted it, mostly through men in hetero relationships. So, I think there is that divide that exists. And I think wholly on early, we knew we weren't doing a great job at reaching women living with HIV. So there were some few projects here and there over the years, but nothing that was sustained. Saving face is, I think, pretty ubiquitous to all of the API communities. I think it has to do a lot with the shame and honoring your family, making them look good to the outside world, no matter what crazy is going on behind closed doors. and really how this has impacted HIV is because we don't talk about sexuality openly, or what's mental health issues, or whatever's really kind of the real issues of just living. It does create the silence, right? If I feel like I might be at risk, how do I broach that conversation with someone I might be engaging in a partnership with or sex with? Like, I don't have that language or space to do that, or the skills. Model minority in the United States means that Asians generally are pretty well off. They contribute highly to society. The problem with the model minority myth, I mean, it's a myth essentially, is that it's a form of racism. By putting a certain group of Asians sort of on a pedestal, it means that the model minority myth really allows the U.S. government or mainstream communities to dismiss sort of the natural, everyday problems that we all face and humans face. It also creates a little bit of an internalized silence within the API community. Well, we're doing pretty good. We're experiencing racism, but it's not as bad as, the African American community. So there's also this silencing, suppressing, and diminishing of the level of racism we incur. And different communities really experience it differently. When I worked at API Wellness Center for many years, I feel like the Pacific Islander community sort of held the spiritual healing for the community. It's like almost the spiritual heartbeat of the organization. But sometimes I feel like the Asian community sort of didn't step forward around really acknowledging sort of that, feeling that spiritual healing piece through sort of faith. What I saw emerge, though, within the South Asian Muslim community, and particularly the LGBT community, was this sort of renewal, exploration of how can kind of their faith and being queer really come together. And then for folks who were also HIV positive, to use the faith as a healing power, and to create more whole self.